Personal hygiene and care can make an enormous difference in the way we feel about ourselves. Just the simple act of brushing our teeth makes us feel so much more refreshed after a long night's rest. Hi, I'm Kathy Getrist, and today we're going to be talking about personal hygiene. The personal care measures that we're going to be focusing on today will include brushing the teeth and dentures, nail care, as well as perineal care. Personal hygiene refers to cleanliness and health of the body. Personal care and hygiene measures are included in activities of daily living, frequently just called ADLs. And it's those activities that are done every day for most people. Assisting with personal hygiene measures will be one of the main responsibilities for you, the caregiver. Holistic personal care is the concept of treating the whole person as an individual. Personal care provides for physical needs such as cleanliness and infection control, as well as psychosocial needs. For example, providing perineal care for a resident certainly does help them if they've been incontinent of urine, makes them feel more refreshed, free of odor and skin irritation, but it also helps their self-esteem and their appearance. Personal hygiene practices are influenced by personal preference and vary greatly from individual to individual. I'm sure if I asked each of you who's watching this videotape whether you brush your teeth before breakfast or before meals or after meal, I would get varying answers. Most people hold strong opinions about how, when, and where to perform the personal care activities. And patients have a right to make choices according to preferences, and those choices should be respected and followed whenever possible. Personal hygiene practices are also private activities for most people. For example, taking a bath, brushing teeth, or even applying deodorant are usually done in private. Do all you can to protect privacy. Do not ever unnecessarily expose a person's body during the personal care procedures, and remember to close the door, draw the drapes and privacy screens if they're available when providing care. The first personal hygiene measure we'll talk about is oral hygiene, which is about the care of the mouth and teeth. Proper cleaning of the teeth and mouth helps to prevent tooth decay called dental caries. It also helps eliminate bad breath. Medical term for that is halitosis. Provides an opportunity for inspection to see whether there might be any broken teeth, any irritation of the gums, sores, cracked lips, and it also contributes to physical and emotional comfort. Patients should be encouraged to do as much as possible for themselves. Routine oral hygiene is provided in the morning, before or after meals, and at bedtime. Now I'd like you to watch a demonstration of assisting with oral hygiene. Assemble the equipment on the overbed table and pull the privacy screen. Position the patient at the sink or upright in bed. Place a bath towel over the chest and shoulders. Pour water over the toothbrush and apply paste. Put on your gloves. Assist with brushing as needed. Use up and down motion, the gum surface to the edge of the teeth. Brush the tongue and gum surfaces. Rinse the mouth with water. Place the emesis basin near the chin for return of fluid. Repeat the brushing and rinsing as necessary. Dry the lips with a paper towel, bath towel, or washcloth. Floss the teeth daily. Select a piece of cloth about 12 inches long. Wrap the ends of the dental floss around the middle fingers, leaving the center area free. Gently insert the floss between each tooth. Move the floss from the base of the tooth to the gum line. Rinse the mouth with water. Offer mouthwash. Dilute if desired. Wipe the mouth and chin. Lubricate the lips if desired. Remove the towel and rinse the toothbrush with water. Remove your gloves. Lower the head of the bed and return the equipment to the proper storage area. Mouth care needs to be done more frequently on certain patients to prevent odors, drying of mouth, and accumulation of secretions. Some of these patients may be unconscious, those that are vomiting a lot, experiencing a high temperature, breathing through their mouth or receiving oxygen, and those residents who may be in the dying process. Mouth care should be done at least every 2 hours. Position the individual that may be unconscious or in the process of dying on their side so as not to choke when doing mouth care, also called aspiration. Use commercially prepared toothettes and swabs in place of a toothbrush for these special needs. There are a variety of lubricants that might be used for the lips. You're seeing a variety of them on the screen. Always assume that the patient can hear you and explain the procedures and talk to the individual throughout the cares, even if they give no indication of being able to hear you. Now watch a demonstration of special oral hygiene. Position the patient flat in bed with their head turned to one side. Protect the pillow with a bath towel. Place the emesis basin over the towel to catch secretions. Apply gloves. Clean the mouth using a toothette with diluted mouthwash or other ordered cleaner. Limit excess liquid to prevent choking. Clean the inner surfaces of the mouth, including the gums, teeth, and tongue. Repeat as needed. Discard the used applicators in a plastic bag. Wipe the secretions from the lips and corners of the mouth. Apply lubricant to the lips. Remove your gloves. Clean and replace the equipment to the proper storage area. Dentures are removable artificial teeth. Some patients have upper and lower dentures, others have just upper or just lower, while others still have a partial plate. Patients may feel embarrassed about wearing dentures and may dislike being seen without them. In the past, I've worked on a surgical unit where dentures were required to be removed for surgery. Many patients would tell me, "Oh, I don't want them removed now," but would wait until they got down to the surgical suite. They would be removed then and then placed back in their mouth after the surgical procedure before coming back up to my unit. Frequently, the patient said, "My family has never seen me without my dentures, not even my spouse." Provide privacy when dentures are removed and cleaned. Remove the lower denture first by grasping it firmly, easing it upward, forward, and out of the mouth, followed by grasping the upper denture, easing it downward, forward, and out of the mouth. Be sure to handle dentures carefully. Transport them in a cup or emesis basin that has been lined with a washcloth or paper towel. If dentures are broken, patients are having to have very soft food or pureed foods until those dentures can be fixed, not to mention the cost involved. So be very, very careful when handling them. Hold the dentures over a sink in a cup or emesis basin that has been filled with cool water. Use a denture brush if it's available, as it's designed specifically for cleaning dentures. Clean and check the patient's mouth for any signs of gum irritation that might have occurred from the dentures. Store the dentures in a safe place when out of the resident's mouth, for example in a bedside drawer, in a denture cup labeled with the patient's name. Now please watch a demonstration of denture care. Apply a towel under the chin. Apply the gloves. Allow the patient to remove and clean the dentures if able. Assist if necessary. Place the dentures in a cup or emesis basin for transport to the sink. Assist the patient to rinse their mouth with water or mouthwash. Hold the emesis basin under the chin for removal of the mouthwash. Wet a toothette or applicator with mouthwash or water and assist to clean the gums and tongue. Inspect for condition of teeth, mouth, tongue, and lips. At the sink, hold the dentures over the cup or emesis basin of cool water to act as a buffer if the teeth are dropped. Keep the dentures out of the sink as it is considered a dirty area. Apply toothpaste and brush all surfaces with the denture brush. Rinse the dentures thoroughly under cool water. Place the dentures in a denture cup of fresh, cool water. Place in a safe storage area or assist to replace in the mouth. Remove your gloves and wash your hands. Clean and replace the supplies to the storage area. Nail care is usually done during bath time. It's frequently one of the first activities of daily living that the resident can no longer do for themselves because it requires dexterity, flexibility, and good vision. Routine nail care can help prevent infection. This is particularly important for patients that have diabetes and those that have poor circulation. Fingernails and toenails must be kept short, clean, and free of any rough edges. With inactivity and the elderly, nails may become brittle, thick, and difficult to trim. It's easier if the nails are trimmed after soaking in warm water. Trimming the nails weekly makes the job easier as well. If the nails are long, they're much more likely to split when they're being trimmed. There's a variety of tools that are used for caring for nails. Emery board or nail file for smoothing the rough edges. An orange stick, when available, works well for cleaning under nails, as does a nail brush. Clippers should be used for cutting rather than scissors. Never use a scissors for cutting, as you might accidentally cut them. Nails are to be cut straight across, not curved on the edges. Observe carefully during nail care for any broken nails, hangnails, corns, calluses, open or irritated areas, and be sure to report any of those abnormalities to your supervising nurse. There are certain residents that will have their nails, especially the toenails, trimmed by either a licensed nurse or a podiatrist. A podiatrist, another name is a foot doctor. These are residents who have diabetes, poor circulation, are on certain medication, or have some other health condition. Be sure that you check the policy and procedure at the facility you work in to determine the policy for nail clipping there. Also, read the foot care for the diabetic in your student manual that follows in this unit. Now watch a demonstration of cleaning and trimming the nails. Assemble the equipment. Apply your gloves and protect the workspace with a bath towel or water-absorbent towel. Soak the resident's hands or feet about 20 minutes in warm water, 105 degrees, to soften the nails. Wash the resident's hands or feet with warm, soapy water. Clean under the nails with an orange stick or tip of the file. Be gentle so as not to injure soft tissue. Wipe the orange stick on the towel after each nail. Push the cuticle back with the orange stick or washcloth. Clip the nails straight across above the tips of the skin. Dry hands or feet. File the rough edges using an emery board or nail file. Apply lotion and gently massage. Remove your gloves. Clean and replace your supplies to the storage area. Wash your hands. The perineum is the area between the individual's legs. Perineal care may be performed as part of the bath, or it can be as a separate procedure. For example, if a resident has been incontinent of urine or has had diarrhea, then perineal care would be needing to be done then as well. Perineal care, oftentimes shortened to be just called pericare, means to bathe the area inside or including the genitals, and in the female, that's the pubic and vaginal area, and in the male, the penis and scrotum. And in addition to the genital area, it includes the washing of the rectum and anus area. Pericare is awfully important. It removes microorganisms from the skin, eliminates odors, and prevents skin irritation and infection. The perineum is a very warm, moist area, really ideal for bacterial growth, unpleasant odors, infection, and skin irritation. To prevent this, the perineum needs washing with soap and water daily and immediately after contact with any feces or urine. Perineal care can be done while the patient is in bed or while sitting on the toilet or commode. There are a variety of skincare products for cleaning the perineum besides the use of soap and water. Might use peri-wash, might use a peri bottle or a pitcher, which allows for better rinsing of the soap and debris. Become familiar with the variety of products that are available in your facility. Always wash from front to back when doing pericare, and observe carefully the condition of the skin, any discharge or unusual odors that the patient may be having, and report those immediately to the supervising nurse. Now I'd like you to watch a demonstration of perineal care on the female resident, followed immediately by perineal care on the male resident. Pull the privacy screen. Position the patient on her back with her legs separated and knees flexed. Protect the bedding with a waterproof bed protector. Provide privacy with a bath blanket exposing only the area to be washed. Apply your gloves. If a patient is soiled with urine or feces, wipe off excess material with toilet tissue prior to washing the area. Wash the outer labia and rinse thoroughly. Separate the labia with one hand while using the other hand to control the washcloth. Use soap or special peri-wash solution to cleanse the area. Wipe from front to back, clean to dirty. Use downward strokes only from the pubis towards the rectum, changing the location on the washcloth with each wipe. Do not wipe back and forth, as it helps prevent the rectal germs from getting to the urethra. Repeat these downward strokes as needed to wash and rinse the area. Pat the area dry. Turn the resident on her side. Cleanse the rectal area without contaminating the perineal area. Observe the areas for any abnormalities and report to the supervising nurse. Remove the bed protector. Cover with the linens and remove the bath blanket from underneath. Remove and dispose gloves and soiled linen. Clean and replace the supplies to the storage area and wash your hands. Position the patient, protect the bedding, and provide privacy as was demonstrated with the female perineal care. Apply your gloves. Hold the penis with one hand while washing with the other hand around the meatus or the opening with circular motion towards the base of the penis. If the patient has not been circumcised, retract the foreskin to wash and return the foreskin over the head of the penis after washing and rinsing. Rinse the male thoroughly. Wash and rinse the scrotum. Dry the entire area. Turn the man on the side and complete the pericare as demonstrated with the female.